signs and symptoms can be associated with an allergic reaction. Anaphylaxis patients has either respiratory distress or signs and symptoms of shock. And we talked about both of them and why they're occurring already at this point. As far as patient care, obviously manage their airway. If they're having any kind of difficulty breathing, just put them on an NRB. If they are not breathing adequately, then we're going to breathe for them if we need to. So like it says here, apply high concentration oxygen. That would be your NRB, a non-rebreather mask at 10 to 15 liters per minute. It is for your mild allergic reactions. Mild allergic reactions do not require oxygen, but if your patient is having difficulty breathing, you definitely want to administer some oxygen. If not breathing adequately, provide artificial ventilations. Like I said, if they're not breathing adequately, we breathe for them and we use the bag valve mask. So as that video showed, you might want to assist your patient with epinephrine and see if patient is not wheezing or showing signs of respiratory distress or shock. Continue with assessment, consult medical direction regarding use of auto-injector. If they are not going through anaphylaxis, but they do have the EpiPen, yeah, make sure you at least have it on standby. Ask the patient if they have it on them. If they do have it on them, tell them to show you the EpiPen so you can look at it, make sure you know how to use it in case you do have to use it. See, after using auto-injector, obviously you want to record the time you give it the medication. It is going to help for patient care down the road. Transport patient and reassess after 2 minutes. If you use the EpiPen, that means this patient is going through shock most likely, and they could be possibly dying. So you definitely want to reassess them every 2 minutes or so. To perform a reassessment, paying special attention to patient ABCs. And here's a video on anaphylaxis from the actual PowerPoint. So I'm going to play it and then share it with you guys. Looks like it's not letting me share that one. Give me a second here. That's fine. I actually I'll just show you the ones that I have on the EpiPen. I have another one I want to show anyway, so I'll show that one instead. Okay. Auto-injector, here we go.
Hello, my name is Roy Ramos, and I'm an instructor at Health One EMS. I'm going to demonstrate the use of the epinephrine auto-injector. First, I will take the appropriate BSI precautions. For this skill, I will be using gloves. Next, I will verbalize the indications for epinephrine, which are to treat respiratory distress due to anaphylaxis. The contraindication for epinephrine auto-injector would consist of a patient who does not have a prescribed injector. Once I have the injector, I examine the medication, ensuring the 6 rights are met. They are the right patient, the right medication, the right dose, the right concentration, the right route, the right time, and the right documentation. I call medical control for an order to administer an auto-injector. Once I have the order, I remove the safety cap and insert the auto-injector pen firmly into the lateral thigh. Hold it there for 10 seconds, confirming the medication is administered. I document the time, the dose administration, any response to the medication, and the physician who authorized the medication. During transport to the hospital, I will monitor the patient by reassessing their vital signs, airway, breathing, circulation, and watching for any negative effects. Administering an epinephrine auto-injector is a potentially life-saving skill. Thank you for watching. Good luck, and again, stay safe.
All right, so that was how to do an auto-injector. New share, go past this. All right, let's see if we can play this video here. See what this is about. See. Maybe this one will play for us. Oh, looks like it is. All right, I'm going to share this one from the PowerPoint.
Allergic rhinitis occurs when people who are allergic to airborne Allergic rhinitis occurs when people who are allergic to airborne particles of dust, dander, or the pollens of certain seasonal plants have been exposed to these substances. Symptoms include coughing, headache, sneezing, and itching nose, mouth, and eyes. When an allergen is inhaled by a person with a sensitized immune system, it triggers antibody production. These antibodies bind to cells that contain histamine. When the antibodies are stimulated by pollen and dust, histamines are released. This causes itching, swelling, and mucus production. Symptoms vary in severity from person to person. Very sensitive individuals can experience hives or other rashes. Heredity and environmental exposures may contribute to a predisposition to allergies. The history of the person's symptoms is important in diagnosing allergic rhinitis, including whether the symptoms vary according to time of day or the season, exposure to pets or other allergens, and diet changes. Allergy testing may reveal the specific allergens the person is reacting to. Skin testing, the most common method, includes intradermal scratch patch tests. The goal of treatment is to reduce allergy symptoms caused by the inflammation of affected tissues. The best treatment is to avoid what causes allergic symptoms in the first place, or to take steps to reduce exposure to allergens. Medications include over-the-counter and prescription antihistamines, nasal corticosteroid sprays, and decongestants. Allergy shots, also known as immunotherapy, are occasionally recommended if the allergen cannot be avoided and if symptoms are hard to control.
All right. See what else we have in this PowerPoint. All right, so self-administering epinephrine. So all the epinephrine does, it reverses anaphylaxis. So there's these properties. It has let's see, alpha 1, beta 1, and beta 2 properties in epinephrine. And see, beta 1, alpha 1 is the vasoconstrictor. So alpha 1 is going to attach to the alpha receptors in your vessels and constrict your vessels. Beta 2 receptors are going to attach to your beta receptors in your lungs and relax the muscle so that it opens up, okay? And your beta 1 is going to attach to the beta receptors in your heart to increase contractility, to make it beat faster, right? So it just pretty much reverses it, and that those properties are what reverse anaphylaxis. Of course, get medical direction before you actually help administer epinephrine. Make sure the 5 rights are good. Side effects, like I said, it's going to increase the heart rate and cardiac workload. You showed all this stuff in the videos. So let's see. Record administration, we talked about that. Reassessment may show patient's condition deteriorating. Additional dosages of epinephrine may be necessary. And if you want to give it again, you have to call medical direction to give it. Bringing patients additional auto-injector in ambulance. If no auto-injector is available, request ALS intercept. And what that means is that a ALS unit will meet you somewhere, usually en route to the hospital if you're en route to the hospital. And then usually what happens is that instead of taking the patient from one rig to another, the paramedic will just jump on your rig and take care of that patient. If you do not know the dosages for patients, write these down. So for adults, the dosage is 0.30 milligrams. It's wrote down as a 0.3, but it's 0.30. And for children, being your pediatrics, it's 0.15. So it's half the dose. So I'll give you guys a few seconds if you guys want to write that down. All right, here we go. So that's it for the